Hi, welcome back to my channel. Our topic for the last 2 weeks has been music therapy in the NICU, or the Neonatal Intensive Care Unit, and I am so excited to dive into what I've been studying the last few weeks and to share it with you. I love leaving little snippets on the Music with Mars socials, but these videos are the highlight, at least for me, since I get to tell you all about the science and the research behind music therapy with the current population, and to give some genuine tips and some best practices out there for those who want them. Today's video is primarily about music therapy in the NICU. It'll be about 20 minutes of how music therapy helps in the NICU and the science behind how it works in that environment. But I will touch a little on IUI, IVF, and fetal loss at the very end of the video. I remember studying about music therapy in the NICU back when I was in university. We only studied the topic for about a week, and I was absolutely fascinated. It's a younger branch of a slightly new field. Music therapy started in hospitals after World War II, but the research has already come a long way. So we are going to talk about PAL, or the pacifier activated lullaby, kangaroo care, and so many exciting studies. So let's get to it. If you've not watched my previous video, or if you're unfamiliar with music therapy, I'll put up the proper definition on the screen for you. My quick definition is when a music therapist uses music to help clients reach non-musical goals. Again, this video is not music therapy. It is meant for educational purposes only, and it is meant to be helpful. In each video, I start by listing a few possible non-musical goals for the population. So in this case, premature babies in the NICU. So we'll spend a little bit of time just thinking about the setting of a neonatal intensive care unit. So pregnancy is considered to reach full term at 40 weeks, and the cuties in the NICU are going to be younger. They're going to be 23 to 36 weeks of gestational age, so the week of growth the baby would be experiencing if still in the womb. Quick side note for you, the youngest documented premature baby that survived labor is a little guy named Curtis Means. He was born July 5th, 2020. He was at 21 weeks 1 day when he was born, and I'll link that story down below for you. It is absolutely powerful. So within the NICU, there are 4 levels. It depends on baby's age, weight, and then the level of care that they need. You'll find phenomenal nurses there, doctors, speech therapists, physical therapists, occupational therapists, hopefully a music therapist, and more specialists as well. My mother-in-law is a certified cuddler at the NICU, so you might find one of those as well. You'll find a lot of incubators for the babies and lots of machinery with lots of beeping. One article said it has been found that preterm infants in the NICU are touched, positioned, examined, and manipulated more than 8 to 12 times over a 4-hour period to assess and evaluate their clinical status. Each one of these stimuli can be viewed as a stressor by the immature system of a premature infant, which can lead to impaired oxygenation, blood flow, heart rate, and behavioral responses. One article says the biggest problems preemies face is stress, which can make it difficult for them to breathe deeply. Environmental noises such as medical equipment, alarms, personnel noise in the hospital can set preemies under additional stress. A third article explains that premature babies are 50% more likely to need special education later in life. Since the neurological system develops in the 3rd trimester, or the last 3 months of pregnancy, a baby that is born 3 months early is having its brain develop within the conditions of a NICU, which can lead to unstable breathing and heart rates. Poking and prodding from medical procedures can also cause infants to associate touch with pain, and living off a feeding tube for an extended period of time can leave babies with limited instinct to eat on their own. So as you can imagine, the NICU is a wonderful but highly emotional and stressful place to be. The staff is working hard to help the preemies reach different developmental markers. The parents are seeking to bond with their baby. The goal of the hospital and the parents is to get the baby as healthy as possible and home as soon as possible. And that's where the non-musical goals of a music therapist come into play. So a music therapist in the NICU is seeking to partner with the staff to help the preemies reach all of those necessary developmental markers and to help the parents bond with the babies, and most of all, to help the baby become as healthy as possible and get to go home. In large part, assisting with the baby's health is going to include decreasing the baby's stress level so that the baby is able to eat, gain weight, and make it home. I honestly think you're going to be surprised at the amount of impact that music therapy has on the babies in the NICU. One study says music has been shown to reduce the number of days to discharge, reduce pain response behaviors, increase weight gain, improve resultant scores, improve parent-infant intimacy, improve oxygen saturation, increase formula intake, stabilize vital signs, and increase parental reports of calmed infants. So let's talk about how this works. In one particular study, the neonates, or the newborns, were divided into two groups, a control group that received standard care and the second group that received music in addition to standard care. So group 2 received music 3 times a day for 60 minutes at a time. They listened to pre-recorded lullabies and children's music. The group that received music 3 times a day showed that the music stimulation significantly reduced initial weight loss, increased average daily weight gain, increased formula or calorie intake, reduced length of stay in the neonatal unit, and reduced daily group mean stress behaviors. So in other words, the babies were able to gain weight, go home earlier, and as a whole group, they showed fewer signs of stress. Another study used music with kangaroo care. So quick definition of kangaroo care from the World Health Organization. It is skin-to-skin contact between a mother and a baby along with exclusive breastfeeding. So the World Health Organization goes on to say that this contact should begin as early as possible after birth and happen for as many hours as possible per day, ideally recommending skin-to-skin contact for 8 to 24 hours daily. These recommendations apply to all babies born preterm or with low birth weight. So for that study involving kangaroo care, the mothers in group 1, the control group, only participated in kangaroo care. So they had the baby placed directly on the mother's chest for a period of time. Group 2 experienced music therapy with kangaroo care. The group with music therapy encountered reduced pulse, slowed respiration, increased transcutaneous oxygen saturation, and stabilized blood pressure. These results were accompanied by parental reports of calmed infants and self. These are really great results. Pulse slowing down, breathing slowing down, more oxygen in their lungs, more stabilized blood pressure, as well as parents noticing calmer behavior with their little ones and with themselves. A third study examined preemies after a 5-minute crying episode. On certain days, the babies received music, specifically lullabies at below 70 decibels after a crying episode, and on other days, they soothed the babies without a music condition. The researchers then compared the data from the different days. They found that the music days resulted in a lower number and duration of crying episodes. Also, oxygen saturation increased, and both the heart and respiratory rates lowered after the music. Those are 3 wonderful studies. Another article I read referenced 13 studies with a total of more than 1,000 participants and found that across those studies, music therapy had a significant influence on the preterm infant's heart rate, respiratory rate, oral feeding volume, stress level, and maternal anxiety. So far, we've been looking at a lot of quantitative data relating to music therapy in the NICU. I also want to look at some qualitative data as well as explanations of why music therapy is so powerful in this setting. So first of all, music therapists are trained to know what volumes of sound are appropriate for the babies in different gestational ages and which sounds could cause harm to a premature infant's ears. Also, by recreating a womb-like environment through sound and music, music therapy has been shown to deepen the infant's sleep state, support infant self-regulation, assist in the stabilization of breathing and heart rates, enhance parent-infant bonding, soothe irritability, reinforce feeding, sucking rhythms and weight gain, and promote a sense of safety during painful procedures. Secondly, music therapists can pair light touch at the correct age with the appropriate level of music to introduce the preemies to positive interactions that involve touch. One NICU music therapist says, "We're helping them learn that not all touch is bad by providing positive reinforcement through singing or humming while doing light touch, so they won't be fearful of sensory experiences as they grow." She will make the same gentle motion 10 times in a row so the baby learns what to expect and to trust her. Music therapists in the NICU will often sing the same songs in a row for that same reason. Third, music therapists are equipped to work with a team of specialists in the NICU in order to help the baby's underdeveloped organs grow while providing nurture to the babies at the same time. One article says, because music therapists are specifically trained to understand developmental milestones for the preemies, they work directly with the medical team to incorporate music into the baby's care plan. The therapy can include live or recorded music and singing, and the stimulation it provides increases with the baby's sensory development. Overstimulation can lead to sensory and neurological issues later in life. Additionally, one music therapist created the pacifier activated lullaby, or PAL. It plays music when the baby starts sucking on a pacifier, and then it stops playing the music when the baby stops. This plays a big role in helping babies learn to suck from a bottle and to associate sucking as a positive experience. And that results in the babies gaining weight faster and going home sooner. Another way music therapists play an important part in the NICU is their ability to assist the parents of young babies. It is not uncommon for the parents to experience anxiety attacks and stress after the trauma of an unexpected early birth. One NICU reports having a music therapist that led sessions with a mom to lower her levels of stress and to assist with anxiety attacks, as well as using meditation led by the music therapist to help calm the mom's nerves while she held her baby using kangaroo care. Through kangaroo care and music therapy, both mother and child stabilized their heartbeats and regulated their breathing by taking cues from each other. Those music therapy techniques to lower anxiety can be used in different parts of the hospital with similar fields. I did mention that I would briefly touch on IUI, IVF, and fetal loss. Obviously, the parents of babies in the NICU are experiencing emotional trauma and stress. Likewise, parents going through IUI or IVF are dealing with a lot of different emotions and stressors during their preparation periods, their procedures, and waiting on the results of a test. Music therapy can be powerfully applied in these settings as well. One study I read worked specifically with moms experiencing complications during their pregnancies. Each mom was currently hospitalized during the study, and each one then participated in music therapy designed to help them with their emotional well-being. An analysis of data from the antepartum bed rest emotional impact inventory revealed significant changes in the emotional health of these expectant mothers after their music therapy sessions. Analysis of post-session questionnaires suggested 4 primary types of emotional benefit: improved connections to family, normalization of hospital experience, emotional relief, and new resources to manage the hospital experience. 2 IVF studies showed that interactive music therapy was effective for stress reduction in women during assisted reproduction techniques, and that the mean anxiety scores in the interventional group that received music therapy reduced a statistically significant amount. One journal article provided a meta-analysis of 7 studies with about 800 participants total that were undergoing assisted reproductive technologies to assess the impact of music therapy in these settings. Across those 7 studies, researchers found that music therapy resulted in lower anxiety scores, improvement of pain scores, as well as an improvement of satisfaction scores. The women receiving music therapy also had a higher rate of clinical pregnancy, but not by a significant amount. Furthermore, hospitals that offer music therapy are able to assist grieving parents in a unique way after the experience of fetal loss. One hospital mentions having a music therapist in the operating room, saying, "We already have a comprehensive bereavement program for our families who experience the loss of a child, but we wanted to make what goes on in the operating room less stressful and more compassionate. We've learned that the sounds of some equipment we use can range from somewhat distressing to traumatic. Also, mothers are sometimes upset by communications between members of the care team during procedures. In creating a way to alleviate stress, we looked at research that shows how listening to music during certain procedures has improved the experience of mothers." Finally, music therapists who work with parents experiencing loss are able to create a recording for them that has their baby's heartbeat, along with a song that acts as a tribute to the pregnancy. In my opinion, it's one of the best gifts a music therapist can give during a hard time. If you are experiencing a great loss, or if you're currently experiencing stress of an assisted reproductive technique, I highly recommend getting in touch with a music therapist to walk you through that season and to help lower amounts of stress and anxiety. If your hospital has a music therapist on staff, please make sure to take part in what they offer. If you have a little one in the NICU, you should definitely make time to have your own sessions with a music therapist, have them do personal sessions with your baby, and then ask for sessions together to encourage bonding. If you do not have access to a music therapist, here are a few suggestions I have for you in your current season. If you are undergoing IUI or IVF, I would recommend finding or creating a playlist with a tempo of 60 beats per minute to play in the waiting rooms, during procedures if allowed, and as you wait for test results. This will help lower levels of anxiety while also encouraging blood flow to your vital organs as your heart rate matches the pace of the music. If you are unable to listen to your playlist during a procedure, you might be able to hum or think of a song throughout the process, which can help you focus on something other than all that is happening in the room. If you feel up to it, you could always pick a lullaby, and since there is some power in positive thinking, you can envision yourself singing it to a baby of your own. If that feels like it will unearth a lot of emotions you don't want to face in that moment, try thinking of a silly song or a theme song to a show and try recalling different episodes just to change your focus. If you have recently experienced loss, allow yourself to listen to music that matches the emotions that well up over the next few days, weeks, months, and years. Use the music to acknowledge your emotions, but try not to dwell on certain genres for too long if you notice that you start to feel worse after it. If you are a singer-songwriter, creating a song and eventually sharing it with other loved ones can be a wonderful, powerful part of the healing process, but again, it's not something that should be forced. Finally, if you find yourself in the NICU with a preemie or multiple little ones and there's no music therapist around, here are a few practices you can try on your own. So for ages 27 to 32 gestational weeks, you can quietly hum or sing lullabies to your baby. This can be particularly valuable during kangaroo care. Just make sure that you have medical professionals around to help you, as your baby is likely to be connected to various machines at that age. I would also recommend that you start your humming or your singing while you have medical professionals around as well. It might feel uncomfortable at the beginning, but that way they can help you read the responses of your child and let you know if the baby is experiencing overstimulation at any point. For ages 32 to 34 gestational weeks, you can begin to pair the humming or singing with some light touch or movement. Again, take your cues from your baby, slowly increase volume or add pressure if your little one is responding well, but stop if they get fussy. If you're trying something new, make sure to have a medical professional around who can help you read your baby's cues and can check their vital signs throughout the length of the practice. And for ages 34 to 40 weeks, you can incorporate live music or the PAL to reinforce sucking behavior to help your little one associate feeding as a positive experience. Continue to participate in kangaroo care when possible. Remember to continue singing these same songs and continue with these practices when you bring your baby home so that they have moments of familiarity even as the settings and the routines around them start to change. In all of the stages I mentioned, I would recommend picking 3 particular songs. One for the morning, one for midday, and one for evening. We already know as adults that circadian rhythms help us maintain good health in our own bodies. The same applies for babies in the NICU, but it's going to be hard to achieve circadian rhythms as the lighting and the sounds are basically the same throughout the morning and the night times. So choosing songs to signal different parts of the day can help your baby develop a healthy circadian rhythm and prepare for the outside world. Once again, I hope this video was helpful for you in your current season. I imagine that you learned a lot, and I hope you found it as fascinating as I do. If you are interested in music therapy consultation sessions, I do offer those 3 days a week. You can sign up and pay for those through my website. But for now, don't forget to like and subscribe. I'll see you in 2 weeks with my next video, and thank you for enjoying Music with Mar.